Today we have Dr. Trevor Turner joining us again. And before I start jumping into some questions for him, I just want him to remind us who he is and what he does.
Thanks, Casey. Nice to be back here with you. My name is Trevor Turner. I work in an orthopedic sports medicine clinic here on the south side of Atlanta, and try to help patients not only, I guess, recover from musculoskeletal injury, but also work with them on preventative strategies to keep them moving, eating, sleeping, dealing with stress, and hopefully preventing themselves from coming in with some of the injuries that we see on a routine basis. So
I'll also remind listeners that Dr. Turner is a physician coach here at the Healthcare Experience Foundation, part of the team here. And we're going to talk about a really important, I think, subject today, and that's doing some humanitarian work or some volunteer work in an effort to stave off burnout. Dr. Turner is an expert in this field, and I'm super excited to have him talk to us about his own experience and how that's kind of helped him deal with a lot of the stress that goes on in his everyday life as a physician, and I'm sure as a father as well. So let's start off with you telling us a little bit about that time that led up to your decision to go overseas to Africa, in this case in particular, and what led you to want to do that kind of humanitarian and volunteer work.
Yeah, geez, thanks, Casey. To be honest, at first when I got back, I wasn't sure really who to talk to about it or how to talk about it, and so I ended up writing a lot, and then submitting actually some of that writing to kind of an ethics project that my medical school was doing at the time. That was still when I was at the University of Texas. So it was earlier on. I mean, I'd always been interested in doing international work, but when I had left college and went to med school, it's funny because I told my parents, I had friends, a lot of people from Notre Dame, like I think it's 80% or something like that, end up doing service work of some kind, like upon graduation. And so one of my good friends, who's now a fantastic critical care doctor at Hopkins, I think he was going to like Cuba for a whole year or something. And I was looking at all these other people, and I was like, I'm thinking about taking a year off, before I go to school. And, my parents just like laughed, like they're like, no, you're not, they're like, you got into medical school, you worked your whole life to do this, like you're going to start and like figure it out, and I was like, oh, all right. So, yeah, so I went, I think, God, when was that? 2006 is when I graduated college and then started school. Was feeling like I was not, I guess, the kind of medical school applicant who was super science invested, and all I did was biochem all the time and was just really a bright process thinker like that. I was more of the kind of like well-rounded person, I guess, who had done a lot of different things. I had lived in Ireland and studied there for a bit during college. And even though, I was a good student, I mean, I performed well on tests. I found myself more as the type of person who wanted to go into medicine for maybe some of the anthropological and some of the, humanitarian probably reasons. Right. So that already was a little bit different than some folks in my class. And it wasn't even until my last year of medical school, we may have talked about this on the other podcast, but that we had a teacher in an elective ask us whether they would recommend their siblings or best friends or whomever to go into medicine, and nobody was raising their hand except for me. And I was distressed by that because I was like, geez, we haven't even been through residency yet, which is when most people get really, really, sleep deprived and maybe, starting to have symptoms of burnout from what's going on. But so I was looking for something. I think, I had some bizarre expectation that I was going to get out of college and start medical school, and it was just going to be all about the patient and the human being. But that's not necessarily how the system developed. I think there was a guy, Abraham Flexner, who was he was in I think the UK back in around 1910, and so he'd come up with this model, or he was looking at this model of doing 2 years of basic science and then 2 years of clinical work, and then you go on to whatever residency or specialty training, and it developed a lot over the years. But so when I found myself doing that in my first year of med school, I was just kind of, starting to ask questions about, I was like, well, what am I doing here? It was in the middle of, I think, some of the Iraq war. I had family that had been in the military. I was questioning whether or not I could be, trying to help protect human life that way. And so I heard this fantastic lecture by a professor from the Baylor International Pediatric AIDS Initiative. And so they had a grant program where basically you could apply and you could go work in sub-Saharan Africa. And it was a cool program where Baylor and Bristol Myers Squibb had kind of like partnered together, and they would donate antiretroviral medications for people with HIV. And then basically you would go on the ground amongst, medical students versus residents versus attendings, kind of would go together to provide care, really with the goal of like trying to make a dent in places where HIV infection was really, really bad. And then not only do that, but sort of kind of pass off to local experts the ability to sustain this in the long term, so that it wasn't just like, oh, hey, we're going to be here and run a clinic on our own, to help you, like these great, travelers. It was really more of how do we integrate this into the culture itself so that, they can take care of themselves in the long term and live a better, healthier life in their community. So I appreciated that. And so I went to be a part of that for several months in Swaziland, which is a really tiny country. You've got, South Africa on one side, and then you've got the border of Mozambique on the other. And so it's almost totally surrounded by South Africa, and it has a small population, only about 1 million people, but they had a 40% HIV infection rate, which was terrible, right? It was considered the worst in the world at the time. It was certainly not like any environment I'd ever seen or been to. And I think I'd done a little bit. Yeah, I'd done some work in Mexico for like a week before in Juarez, which is like, not a very safe place, but certainly a place where there's plenty of need, and it's close to the Texas border, which is where I was from. And so, Swaziland was a pretty rapid departure from that. It was really not like anything else. And so I think I felt compelled to be involved in service. I felt a little bit like I wasn't serving very much by just going to school and taking tests and, contemplating even a life of, move to a foreign country and practice, international family medicine for the rest of my life. And I probably would have never, I would have always in the back of my mind regretted it had I never tried or experienced it. Right. But so that's maybe a different context than like, hey, I want to go do mission work or, medical volunteer work for a week or two. And there's some great, companies that do that, I think, with, they each have sort of their pros and cons, but, so that was kind of the time of my life that I was embarking on that.
Definitely. And I want to move on to some of the lessons you learned from your time doing aid work. And I want to know about any of those lessons that kind of help you with your everyday life as a physician.
That's a great question. A lot of people, I think when they think about going to Haiti or going to Africa or going to a place to do mission work, you hear a lot of people throw around the term life-changing, right? And so I had really wanted to ask that question because I think one thing that was never acceptable to me was that if you go to a place for a week or two, and you see a lot of people in a day, and maybe you do surgery or whatever it is you do, prescribe medicine, to help is, like, how does that make a difference in the way that you live your daily life when you get back, right? Short of just moving to a place to do that forever, right? Which most people probably who are considering volunteer work are not going to say, okay, well, that's it. I'm leaving the United States and I'm going to live boots on the ground here forever to make a big difference, right? A lot of what we did over there while the work was good, I felt like I was constantly reckoning with my own futility, right? And so we'd see tremendously joyful things. Like we'd be in the clinic and we'd see kids that got started on, antiretroviral or HART therapy, as it's abbreviated for short. a year ago or 6 months ago, and their CD4 counts, their immune system would kind of get better. And they would, they'd start making all these milestones, right? Like they'd do these things that were considered normal for children of their age that they were missing when they were sick and malnourished and couldn't do that, right? The flip side of that coin was for people who are really sick, if you went into the government hospital and you try to take care of them and you watch them die in a way that I was like, well, if we were in the US or if we were in, a tertiary referral center, we could have, intubated that person, put them on a ventilator. We could have put them on more sophisticated nutrition. We could have had better infection control protocols like in the hospital. So those things made me, I was reeling from them. I mean, I would go home and I would play these events over in my head, and a lot of times was agonized by the fact that I felt like I was not doing enough, or I was never doing enough, right? And so some people would just say that's stupid, like, this is a place that has less resources, and you're like a good person for going over there and wanting to try to do something, and you can't be fixated on what you're not doing, right? But I think until you've lived that and you've been amongst suffering at that kind of level, in a way for your fellow, for other human beings, right? Even if you don't look the same and you didn't grow up with the same language and you didn't grow up with, the same kind of food or whatever it is, there are certain like universals, I think, and some of those are like, hey, like you want to be healthy, you want to have a family who loves you, you want to, be able to eat and go to school, and you want to be able to have clothes. Like, so seeing some of those things get violated, I think, it's hard to take with me. And what it forced me to do is either say, okay, well, your response to this set of circumstances is that you're either going to be crushed by this and you're going to be in total despair and you're just going to give up and you're not going to practice anymore because you're going to feel totally broken, or you're going to start to see significance and grace. And I don't want to be like too theological in that sense, but maybe you're going to find significance in acts of compassion and kindness that matter more than you realized. Right now, so I'll try to give you like an example, and it may sound silly, but there was a lady who came to our clinic real early in the morning, right? And we were in a little bit of a mountainous region, so the air was cool in the morning because we were at some elevation. And some people preferred to sort of come in and not be seen, necessarily by people in their community, because there's a stigma, certainly for people who have HIV, right? And we have certain stigmas we deal with in the United States, and then there's stigmas you deal with in different cultures in very different ways. And so I think women in particular in Africa, they're the backbone, certainly, or the unit of their family that holds it together. But when it came to them trying to make decisions about, do I breastfeed my child or do I bottle feed my child? Gosh, I don't want to give them an infection. What if someone sees me at this clinic? What will my, parents think, or what will my spouse think? So these were really big decisions. So sometimes people would come to the clinic early in the morning as a measure of discretion, and I lived pretty close to the clinic, and so I would walk over there early in the morning to get ready for the day and do stuff. And I remember seeing this lady there, and I looked at her and she looked cold, and she was there with her baby. And then, so I was just like, hey, like, can I get you like a blanket or something? Like, are you all right? And she was like, yeah, that would be really nice. So I went and I got her a blanket, and then she took the blanket, even though she was visibly cold, and she just wrapped it around her child, even though the child already had a blanket on. And it was, at the same time, it was like the unselfishness, or I should say the selflessness with which a mother loves her child was so striking right in that moment. I was just like, geez, like this lady would probably, just freeze in an early mountain morning to save her child or do what's right for her child. And Lord knows some of those people, it took them literally days to get to that clinic because think about what it's like to not have a car or a road or public transportation, or it's just that the the amazing complications of travel in the developing world are something we take for granted, I think. Um but the other part of me was sitting there going, okay, like, well, I'm going to see this number of people today, and I'm going to recommend these kinds of therapies, and we're going to work with a team of people to try and make sure we have a counselor who helps them and communicates things well. And even in the cases of like tuberculosis, there were people doing what's called directly observed therapy, right, where they were literally like watching people take their medicine every day in order to prevent disease transmission. But maybe the best thing that I did that day of all of that stuff was give that lady a blanket, right? And it sounds dumb. I mean, it's very humbling to think like that as a physician, because I think, you're like, well, I've been educated and I've had all this training, and really like what my job is to see the most complex problems, right? And to be really, really good when the stakes are really high and disease is really complicated. And how do we make evidence-based decisions with that? And how do you quote unquote practice at the top of your license, if you're somebody who does advanced procedures or surgeries or whatever it might be, right? But on the other hand, in a culture, especially where maybe not everybody understands the same language all the time, and, you don't eat the same things, or you don't worship in the same way, or you don't, watch the same sports or go to the same schools or have the same holidays, giving somebody a blanket when they're cold, I mean, probably made, that woman and her child feel more cared about than a lot of the other things that happened, right? And so then this idea became for me, as I was like, all right, well, certainly I can go back to the United States and I can see people with HIV, and I can work with, underserved populations, and I can do all of that. But maybe, more than just saying, well, hey, I do some volunteer work and that means I'm life changing, is, in moments that are seemingly very, very small or insignificant, the way that you communicate like love and compassion to someone, um, maybe is really the way that life should be changed, right? And I think the nice thing about that is the staying power sort of it gives you, right? Because we have problems with our system in the United States. I mean, on one hand, if you come here for really advanced cancer care or cardiac care or whatever it is, I mean, we we can do organ transplants, we can do immunotherapies, we can do truly amazing things, right? But on the other hand, we have, this whole cohort of people that is just constantly saying the system's broken, the system's broken. I'm overworked, or I don't get to spend the time with patients that I need, or I spend more time typing in an EMR than I do actually practicing medicine. And, I don't like the hospital, or I don't like the private equity group, or I don't like my partners, or I don't like whatever. I mean, there's different problems certainly to be upset about, right? But in that one like that moment, which is so, so sacred, right? Like nobody can take that away from you if you can just see it like for what it is, right? And I think it's easy to lose that, and it's easy to think about problems in a way where all you do is see the problems, right? And if all you do is see the problems and you lose the meaning, um, you're probably not going to find joy in what you do, and people are going to feel that, right? But when you find joy in moments that are seemingly very simple, um, there is something precious about that sustains you, and it kind of gives you, I think, a meaning and a purpose where maybe you don't need to be a physician to do that, or a nurse, or a, you know, allied healthcare professional of some kind, but it makes you feel connected back to your purpose, right? And then I think, on the same token, patients are looking for that, and they tell you how much significance it gives them, right? I mean, if people say, "Oh my gosh, I've seen all these different doctors and all this, but nobody ever just did this simple thing, which communicates such sincerity of compassion," right? And And it feels good. Like, I mean, it's like, that's like, oh, okay. That's why I went into medicine, kind of, right. It reconnects you with that purpose. And so I think, I guess it's ironic, that you almost have to maybe see something that breaks you down in order to be able to then get built back up in such a way that you feel reconnected and feel what you're doing is profound,
Definitely. And I know that you're currently writing a book about these experiences, and you let me read some of that book. And so I'm going to spend the next kind of part of this interview reading some passages from it and having you react to it. So the first, in the book chapter you let me read, you wrote, quote, "In the wake of my own trials, I found that perhaps the deepest grace to be had is the grace we find when it seems there is none to be found at all," end quote. Please react to that and just let our listeners know what you meant by that.
Yeah, thanks for that. Yeah, I mean, I think some of what we just talked about was pretty applicable to it, right? But like, it was funny. One of the things I started trying to do just for my own mental health was writing this gratitude journal where, like, basically at night I just write three things a day like I was grateful for, right? And it was kind of funny because I was looking at it in the context of ways that um like, it shows that it lowers your blood pressure and improves your heart rate variability and all this, all this stuff, right? But I think that's very much the case of, finding grace where you don't feel like it, right? And so, um, eh, when things seem to be hopeless or when they seem to be really hard, I think in particular, I mean, I don't know, we saw a patient earlier in the week who came in with neck pain, which is like, everybody, yeah, once they get past 40, probably, but and it seems very routine. And then she came in and we did an x-ray and we are like, oh gosh, right? And it turns out she had like a cancer, like a tumor that had invaded a vertebrae of her spine. And that becomes like a hard conversation, obviously, right? And so people are not going to retain everything from that encounter. When they hear that word or you show them that picture, they're like, oh, and it's hard to focus on anything else, right? And then it just becomes basically an appointment about, just being like, hey, like we're here for you, like no matter what, and we're not giving up, and we're going to be here with you, and like whatever it takes, and I think, that's probably an example here that, yeah, I mean, it's not taking care of, orphans with HIV, but it's a place where you encounter somebody with suffering, right? And you have to be able to move into that space and dwell with part of that emotional, context, which is really hard to dwell in, but to figure out how to be comfortable enough in it and still be vulnerable enough to meet that patient. That I think is pretty hard, right? Because it's easy to be like cold and closed off, or you can be the person who just, you feel everything all the time, but you have to have some kind of balance, like to be able to function like in this world of being a healthcare provider in the United States. And yeah, so I think that's finding grace when it doesn't seem like there's grace to be found.
Amazing. That is awesome. All right, here we go. Another passage I want to read to you and have you react to it. Quote, "As physicians, it helps us forge the bond with our patients, which is quintessential to the art of practicing medicine. I had not cured HIV, and I had felt crushed by the weight of my inability to do so on a larger scale, but I came back with a new kind of staying power. And caught up in an adventure much larger than myself, I was ready to truly learn how to heal the broken," end quote. That is a passage written by Dr. Turner, reflecting on his humanitarian work and his aid work. Do you have anything else to add to that, or what were you trying to get at to in the heart of that passage?
Yeah, I think I was trying to figure out what I was trying to prevent was, okay, I went and did work that I felt like was really important or meaningful, and then I was just going to come back and just live the same life the way I always did and never really change in any way, shape, or form. And there was actually, it's funny, I read a book by a physician. He was another Notre Dame grad. He was a cardiologist, and he actually went and met like and worked with Mother Teresa in India, which is, I mean, that's incredible. But I think she had kind of challenged. The book was called Mother Teresa's Prescription, but he had I think tried to deal with some of those same demons on his own, and it was interesting how he talked about it because he felt. I think he talked about like he felt very silly or humbled or whatever you want to say it, ridiculous maybe at times that, here he was as this kind of high powered cardiologist, but like he felt like in some way the work that Mother Teresa was doing and the way that she touched people who were dying and comforted them was something like he like wasn't capable of almost, or like wasn't cut out for. Right. And so those kinds of things, they make you reckon with who you are as a person and what you're capable of. But then at the same time, I think when you acknowledge that and then you start to move past it and you say, look, like the real ultimate meaning about what I'm doing is connecting with another human being that is so basic to the way that we express what it means to live and be human in a community. And I think that, I don't know, that's probably where I got to when I left. And then it was great because it was like after that, I was like, man, nothing could stop me. Like I felt like I was in medicine for the long haul for the right reasons. And hope I was right.
Wow. Yeah. I mean, that last sentence you just said really captivates all of it and the value and what you're doing. And that's powerful. So let's wrap up here. I want you to know a couple last minute things. What would you say to someone who's interested in volunteering or providing humanitarian aid, who's in a similar position as a physician, very busy life? What would you say to that person?
Uh, don't make excuses because it's so easy to be like, well, I'll do it next year or the timing's not right or whatever. There's a fantastic, somebody is worried about doing it on their own or not doing it through a medical school or residency. There are certainly great global health programs now in a lot of med schools around the United States. But there's great, I think people have heard of MSF, Medicine Sans Frontières, the Medicine Without Borders. But there's, other people, GRM, like, is great. And I think there's so many partners that make your skill set available to do that. And my temptation, I think early on, especially was like, oh, well, either you're not doing surgery or you haven't had enough training or you're like not used to practicing in a resource limited environment. And just don't let those excuses stop you because you'll be able to make such a difference more than you ever thought you could. And I think you come back to what you do on a daily basis in a way, it makes you better and it makes everyone around you better.
You've been listening to Dr. Trevor Turner. He's a physician coach here at the Healthcare Experience Foundation. Really powerful stuff today. Anything else you wanted to mention before we cap it off?
Yeah, just thanks for having me. I'm rewriting the book, so it's not coming out yet. But
Yeah.
also, Casey is doing a great job with a young kiddo, and he and his wife rock. So good job, man.
Oh, Dr. Turner, I could only hope to be, as accomplished as what you've done as both a father and a amazing healthcare provider. This was a great episode. We will keep listeners posted as the book production progresses. We kind of gave a nice sneak peek today. Dr. Turner, once again, thank you for your time today.
Thanks, Casey. Take care.